Are you confident that Sydney and New South Wales is up to it in terms of hospital capacity with the numbers we're seeing? Already ICUs under strain in terms of personnel and so on. Is it up to it?
Yeah, that's the advice we're getting. And I speak regularly with New South Wales, as does Professor Murphy and Greg Hunt. I mean, of course, it's going to come under pressure, and parts of the system under more pressure than others. And so the workforce, the systems are being optimised to deal with our pressures. They've done very good modelling on the peaking of cases and then the peaking of what the pressure will be on the hospital system. And that's very important. And I think the Premier's been very clear that she's expecting those peak demands on the system to occur in late October, after the peak of cases has actually occurred. So they're planning for it, they're preparing for it. Will it come under stress? Of course it will. Of course it will, as it has all around the world. But this is part of our passage through to live with this virus. And that's the challenge all states and territories will have. You know, if we want to move forward and live with the virus, this is one of the things we're going to have to pass through. And that's why under the national plan, the preparation of the hospital system and the public health system to deal with cases which will inevitably
particularly
arise.
About the personnel levels, though, are you being reassured that we have the people? Because I know the ventilators are there, that the beds are there, but do we have the right people?
Oh, that is the right challenge to be looking at. I mean, yes, the beds and the bricks and the mortar and all of, and the ventilators, and we've done very well on all of that. And the management of the workforce is the challenge, and that's why the private hospital system agreement that we put in place as a federal government, which has already freed up 300 nurses to support the system, and further support is provided. The other key thing is this, Kieran, and that is moving into a different phase about how you isolate close contacts. Now, currently, you know, you furlough, and we have in the past furloughed large sections, you know, of the health workforce because of being close contacts to cases. Now, when they're double vaccinated, the need for that disappears.
Sure.
And so you can take greater advantage of the movement and the scale of your workforce because they are vaccinated. That is a great advantage we have this time round in dealing with this pressure on the system than we did, say, last year. Now, I remember last year dealing with the Victorian crisis. That was a major problem, both in aged care and within the public health system, because there wasn't a vaccine. Yep. And so you had to isolate health workers. This time around, the vaccine gives us that added strength in the system. Now, I'm sure the Premier will tell you the same thing. We're not thinking it's not going to be without its challenges. It is. But they're up to it, and they're planning for it. They're readying themselves for it, and all states and territories need to be engaged in the same process. Now, I know Victoria is. I've had those same discussions with Premier Andrews at National Cabinet. We have just put this has been on the agenda every single week as we're seeking to prepare.